welcome back to your Feel Good Breakfast show on this Tuesday morning. We are in the month of Movember, of course, the month formerly known as November. And of course, this is when men around the world grow a moustache to raise awareness and funds for men's health, specifically prostate cancer, testicular cancer, mental health, and suicide prevention. Now, prostate cancer is on the rise in South Africa, especially among younger black men. And it's reported that 1 in 10 men in South Africa will be affected by prostate cancer. So most men in South Africa have a fear of getting tested or believe that, or in the stigma that getting tested is a violation or not understanding the process of what exactly it's all about. And that's why we've got Dr. Darren Green here to unpack all of the symptoms, the signs of prostate cancer, and then, of course, just get the topic in conversations, make it comfortable. Dr. Green, always great to have you.
Thank you.
Dr. Green, let's start with this. Where is the prostate? Because it's a wildly misunderstood, sort of place, right?
Yeah, 100%. Some people don't even know the difference between the prostate and the testicles, for example. So the prostate lies at the exit of the bladder. It's wrapped around the urethra, which is a pipe that leads from the bladder out through the penis that secretes urine. Now, the prostate is wrapped around just out at the exit of the bladder, so the urethra runs through the middle of the prostate. So you can imagine that prostate has a very specific, there it is, wrapped around, that's the bladder in orange, and that's the urine exiting over there, but that pipe is surrounded by a structure the size of a walnut. If you've seen a walnut, they're very expensive.
Is it, so if this is the urethra, the prostate is like this.
It's wrapped around
like this,
which is important when we get to the symptoms just now.
Okay.
When it enlarges. So why it's quite important is the prostate's function is actually quite simple. It produces and secretes fluid that forms part of semen. So sperms that are made in the testicles, down there in the scrotum, cannot survive if that fluid, obviously, is not secreted with it in the form of semen. So that's its function, and with the muscles around it, it also assists, obviously, in ejaculation as well. So that's where it's at, and that's what its function is.
So a hugely important function as well.
All right, so then let's get to talking about the signs and symptoms of prostate cancer, especially when we think about that biology and understanding that it's wrapped around the urethra like that.
So you've got that draining urethra, and when the prostate enlarges, if there's pathology in it, and there are different causes that can cause it to enlarge, ranging from infection and trauma all the way through to cancer, what happens then is it starts compressing and pushing in on that pipe that's running through it. Then you will have a slower or a weaker stream. So you go to the toilet and you'll find, but gee, the volume is just so much, it's coming out slower, the power is less, etc. You also can't just cut off your urine stream as normal. Once you're done, you're done. There's dribbling. It's called, after dribbling, basically. You also feel that you've got a massive amount of urine that you want to pass, and then you go to the loo and you feel that there's just a little that comes out at a time. And then obviously controlling and having small leaks like urge incontinence is also part of that. And then, in some cases, if there's breakthrough pathology, you could have some bloody discharge as well. So understanding those lower urinary tract symptoms, they call them the LUTs. Those are the signs of obstruction, and those are the poor stream, as I said earlier on, the frequency, going to the toilet a lot. Urge incontinence, like it's leaking, and feeling like you have a massive amount, and then little comes out.
All right.
Well, our lines are open. Dr. Darren Green is here, 021-430-9881. Give us a call if you've got any questions or comments around prostate cancer. It's a very important discussion and a very important conversation that we need to have. But Dr. Darren Green, you mentioned that it may enlarge as a result of infection. What might cause infection?
Yeah, so prostatitis is a big cause. That can happen as a result of infection that spreads from outside the body inside. Can be associated with certain bladder infections or sexually transmitted diseases even as well. And you also get with that a condition called BPH, which is benign prostate hyperplasia, which just means the cells are busy getting bigger and enlarging in the prostate. And it doesn't necessarily mean that it will turn to cancer, but there is a higher incidence of people that have BPH that progresses into proper cancer.
All right, well, we're going to keep our lines open, 021-430-9881. Give us a call. The chat is all about prostate cancer on this Tuesday.
It's my Feel Good Breakfast Show.
All right, we're back again on the hot seat with Dr. Darren Green. It's a Tuesday morning. Of course, medical tat is what we're talking about right now, and prostate cancer is our focus, given that it is the month of Movember, if you are that way inclined. Can you grow a moustache, Dr. Green?
I can indeed.
Can you? Yeah, are you going to?
1 week. I normally handle the first 2 weeks quite well, but then I start itching a little.
Let's recap again. Of course, it's all about creating awareness around prostate cancer.
Indeed.
The causes of prostate cancer. Let's recap that first.
Yes, so, well, prostate cancer as such, the risk factors are being age itself, being older than 40. Generally, the higher you go age-wise, the higher your risk of developing it. Then, obviously, there are associations with lifestyle factors, like obesity, for example. Many people don't know that obesity lowers your PSA, your prostate-specific antigen levels. We'll get into that. And masks it off quite often. And then, obviously, things like smoking play a risk as well. And then people that have recurrent prostatitis, which causes inflammation of the prostate, and people that have BPH, which I mentioned earlier, the enlargement of the prostate, basically that's a benign condition, if not treated properly, can progress and change into cancer.
So how is it diagnosed? How is prostate cancer diagnosed?
Yes, so any pathology of the prostate is diagnosed first by taking a clinical history. So the doctor or the clinician needs to sit with the patient and ask loads of questions, and people need to be communicated to in their own language. It's no use using urge incontinence as the word when no one knows what that means.
Yeah.
So you've got to speak to them. How is the power of that stream? You know, when you go, is it the same as when you were 20? Has it changed since then? And then we look at how many times a day are you going to the loo? And when you go, is it big volumes, small volumes, etc.? Do you have pain when you urinate? Is there bloody discharge perhaps when you ejaculate, for example, as well? That could be significant. And the frequency, as I mentioned. So you would ask those questions historically first, clinically, and then you'd move on into the examinations. Now, there's the digital rectal examination, which everyone has a stigma to regarding the doctor with his gloves. Is it Austin Powers or Dr. Evil or something? I can't remember. But anyway,
yeah.
long of the
One of
short
those.
is that examination often picks up an enlarged prostate immediately and quickly because you can feel the size, the consistency of the prostate. It's probably like a 10 to 15 second examination. As I said, it's not a painful examination. It's more just the discomfort and understanding what's going to be done. And that needs to be done because you feel the contour, the consistency, the size of the prostate, and things can hide. And then there's a blood test that everyone knows about, which is called the PSA test, the prostate-specific antigen, which measures a chemical hormone level. And if those are high, it could indicate that you have significant pathology, and then you need further examinations. And one of those for a directed look at the prostate is a sonar, where they will have a sonar, a probe that you can look at the prostate specifically and then take a biopsy if you need to. But not everyone needs the biopsy, not everyone needs the sonar. The screening tests are the history first and the blood test, and then obviously the digital examination.
Who's most at risk?
Yeah, so the people that are older than the age of 50, people that have a genetic history of prostate cancer, recurrent infections and inflammation of the prostate, and BPH.
All right.
Wow.
Okay. Yeah, I think we're definitely building up our lexicon with regards to prostate cancer and certainly your understanding, and I hope that's the case. We're going to keep our lines open on 0214309881 and be back with Dr. Darren Green very shortly.
It's my feel-good breakfast show.
Welcome back to your Tuesday morning medical chat with Dr. Darren Green, where our focus is on prostate cancer. It is the month of Movember. Men across the world are growing their moustaches to create awareness around testicular cancer, prostate cancer, mental health issues, and suicide prevention. All right, we're getting into specifics now. We got a call on the line.
Joseph is on the line from Johannesburg. Joseph, good morning.
Hi, good morning to you, doctor.
Good morning.
Doctor, I had an operation in May, and I had the pellets actually put in. But I just find now in the last month or two that I get sort of like needle pricking sort of in the sac where the testicles are. I just want to find actually what's the cause maybe of that.
Yes, good. So it sounds like he's had prostate cancer diagnosis. He's gone through treatment. I'm not sure whether he had brachytherapy, radiotherapy, or chemotherapy.
Brachytherapy, yes.
Yes, brachytherapy. So you could have, obviously, the symptoms that he's experiencing of sensory changes radiating into the inguinal canal and obviously down south. One would certainly want to look and see whether what the prostate is doing right now, if it's changed in size, as well as inflammation at the time. So I would definitely follow up with your urologist, firstly, to have a look, maybe even check the PSA levels at this stage. It's been almost 6 months already since the last procedure has been done. So I would do that and certainly notice, obviously, things like the urine changes that we mentioned earlier on regarding the flow in the stream and so forth, and follow up.
Thank you very much
Okay,
for
fine.
the call, Joseph. We really appreciate it. You can keep calling us on 02143098881. Next time I think of PSA, I won't be thinking public service announcement, but rather prostate-specific antigen.
Antigen.
So
Yes.
we kind of spoke a little bit about it. We touched on it where the levels, it's a hormone.
Yes.
It is a hormone in
chemical
the
substance
body.
you can measure in the blood. Yeah.
Exactly. So what are normal levels of
Yes.
PSA?
So the upper limit of normal is just under 4.
Okay.
So if you have a level, a prostate-specific level, obviously that there's a reference range, 0 to 4.
Okay.
If you have a level that's high, there's one of 9.9, for example.
Yes.
That means that there could be inflammation of the prostate. That doesn't tell you what the cause of the high PSA is. So that's often a good screening tool for you to then have the follow-up investigations done, have the sonar done, have a biopsy done if needed, etc., and then do what they call follow-up or sequential values to see if it comes down after treating the initial problem.
Now, you mentioned earlier that the older you get, the more high risk you are, right? So at what age do I start testing? When do I start testing for prostate cancer?
So we advocate generally over the age of 40, or from the age of 40 onwards, because that's when the incidence obviously starts becoming a little bit. Unless you have symptoms before that, you do get incidences of prostate cancer in younger males, although testicular cancer is the more common cancer in younger males specifically. So remember that. So if you have those LUTS symptoms I mentioned earlier on, before the age of 40, then you'd go and have your prostate checked before then.
Yeah.
Okay.
Go ahead.
Wow.
Good, yeah.
021-430-9881. I want to hear from you if you have been diagnosed with prostate cancer, or if you have tested, or you're looking to test and you want to find out more information from Dr. Darren Green. He's still hanging out with us throughout the morning, and we're continuing this conversation around prostate cancer awareness.
It's my feel-good breakfast show.
Well, an educational conversation has been so far with Dr. Darren Green as we explore and get to know more about prostate cancer during the month of November. Now we know what PSA levels are and how an average of between 0 and 4 indicates a normal range. Anything higher than that might mean that you have an inflamed prostate and so on. But now let's quickly talk about how to reduce your chances of developing prostate cancer. Is there something that you can do?
Yes, you can. Firstly, I think the thing is early screening.
Okay.
So don't forget those symptoms I mentioned, and if you have them checked out. It might just be a mild infection that can be treated. If not, then follow-up tests will be done and so forth. So early screening, number one. Lifestyle has been proven now to be massively a big contributor to prostate cancer. So sedentary lifestyles and obesity obviously increase your risk significantly. So do smoking, and so do drinking more than 2 units of alcohol a week.
Two
And
units.
two units is like, what, 2 cans of beer?
Did I say a week? I meant a day.
A day. Hey, people sweating there. December's coming up and you...
So remember they are. And then obviously there is a risk with smoking as well. But the lifestyle factors are unbelievable. So eating properly, looking at food that causes inflammation in your body and starting to move. You know, the November campaign's theme this year, dying too young. We're trying to prevent that. So getting off your butt and moving and walking is what we're trying to advocate.
Yeah. Now I've been diagnosed, let's say, and I've got prostate cancer. What are my treatment options?
Yes, so depending on the stage of the prostate cancer and the size of the tumor or whatever, you'll then go through a staging process, whether it's spread to the regional lymph nodes, whether it's metastasized or spread to the bone, metastasized, and then according to that, the options will be discussed, whether you have brachytherapy, where certain radiation beads are put into the prostate itself, whether you have chemotherapy or radiotherapy and surgery as well, where they remove the prostate completely. Also interesting that they remove, obviously, sometimes the testes as well because of the production of testosterone and the effect that has on the cancer, promoting the cancer growing.
Okay.
So often you could have that as well. And then medication, obviously, that suppresses the testosterone levels is often also needed.
Yeah. If someone in your family has had prostate cancer before, are you more at risk?
There is a genetic link, yes. So you should definitely, if you've got a history of that in your family, you can even test and demonstrate the gene nowadays.
Oh, yes?
The question is, if you know that you've got a gene for that, what are you going to do differently? Well, you're going to live the best, healthiest life you possibly can and go for your screenings perhaps even earlier because it's a fully treatable cancer if you detect it early.
Yeah, that's the important bit. Earlier on, we said, of course, people around the world will be growing their moustaches and starting conversations around that. But if you are in the unfortunate genetic pool to not be able to grow a full one.
Yes.
But you still want to get involved with Movember
That's
in
right.
creating
You want to be a Mo bro.
A Mo bro.
Or Mo sister. Mo sisters are out there as well.
Yeah. Or Mo dog.
How do you... Mo dogs?
We're doing Mo dogs now.
That's
as well.
amazing.
Or you could take a permanent marker and draw it in like a decent moustache.
No.
But
Somebody
that's
give
just
me a
me.
marker, please.
That's
But
just
you,
me.
you're sorted. So how do you get involved with Movember?
You need to sign up on the Movember.com website. It's
Yeah.
quite easy. And that you're part of a global initiative that contributes in over 1,200 countries, by the way. And that would cause a lot of a stir in terms of your teams and your corporates and so forth on having this initiative. But it's about opening the conversations around these men's health issues that we've addressed. And once you sign up, you can post pictures and compete, cheer people online, have quite a lot of fun around it. But it's also serious business about raising funds for cancer awareness.
That's it. I like that we're able to have fun with it, but we're having a very important conversation at the same time, and we're having that interaction happen.
Correct.
Any advice on actually growing moustache? Does chicken feces really work?
Oh man, that's another topic.
Let's try this one.
Miracle Tuesday next week. Growing your moustache with chicken feces. No, don't do it. Thank you very much, Dr. Darren Green. And yeah, let's have conversations around prostate cancer, guys.